morning, so hopefully you'll forgive my appearance. This is pretty much what I look like now because I am exhausted 24 hours a day. But anyways, I'll pre-warn you that we may have some distractions because both kids are awake and we have Sesame Street on for background noise, so I'm gonna have to do a little bit of a backstory because this is something I don't believe I discussed on YouTube yet. So Weston has been facing some pretty serious health issues since the day he was born. Thankfully, all but one have proved to be not of any concern anymore. Everything has been tested and gone over. I did post a little update when he was 3 weeks old, saying that I had some serious health issues that I wanted to talk to you guys about that were of a potential concern. And I never did post a follow-up video of that, so I'm gonna do that now. So the first thing, just trying to remember in order how it went, we had some miscommunication when Weston was born about spina bifida. Weston was born with a dimple in his back, which is a marker for spina bifida. However, it's also common for infants to be born with a dimple in their back. Ellie also had one as well, but it was not mentioned to me like his was. The way this doctor communicated to me about this, and when I asked, you know, like what that meant, and he explained to me it was a marker for spina bifida, he did not come right out and say that Weston did not have spina bifida. He said, "Oh, I've seen worse," basically leading me to believe that there is a potential that Weston had spina bifida. We have followed up with 2 other doctors since, and he does not, so thankfully there's that. He also failed his hearing test when he was a newborn, which is super common. That one I really wasn't worrying about because when they're born sometimes they have some leftover amniotic fluid in their ears. At his 6-week appointment he passed with flying colors. Then there was the big one, cystic fibrosis. So when every baby is born, I know in Canada anyways, they do a heel poke test, which tests for various degrees. Ellie, mommy's talking right now. Various life-threatening illnesses, one of them being cystic fibrosis, which Weston tested positive for. Now, testing positive with this test does not necessarily mean that your child has cystic fibrosis. The test could have been done wrong and it would test positive. It's just if it's not done perfect, if it's off in any way, shape, or form, it will come back as positive. So I got a call when Weston was 10 days old letting me know that he had tested positive for cystic fibrosis and a thyroid something or other. And we needed to come in and do a redraw. It was 2.5 to 3 weeks before I got those results back. I cried every single day. I guess it's common for those things to come back as positive because it's very easy to have an error done with those tests. So it doesn't matter. It doesn't matter. You could say it's super common and I wouldn't care. I spent every day crying thinking there's a potential that my child has a life-threatening illness, and you know, I don't know if I'm a carrier for cystic fibrosis or if the donor was a carrier for cystic fibrosis, and you need 2 people to carry the gene in order for your child to have the disease, and I didn't know who was a carrier and who wasn't. So not having that information was very stressful. Once we got those results, everything was in the clear, including the thyroid condition. Mommy. What, baby? That's Big Bird. Yeah, he's really tired. He's going to bed. Once we got those results, I was completely over the moon that we could finally relax. So I thought. We went to Weston's 6-week checkup, technically his 1-month appointment, to find that he had a heart murmur that was never detected before. I don't know if they just didn't listen hard enough. The doctor that came in and did his checkup when he was in the hospital is the same one that had the miscommunication with me about the spina bifida, and I don't find that he did a very good job at all. So I figured it might have been easily looked over. She told me that, you know, this is a very common thing, but she was going to refer him to a pediatrician just to be on the safe side. In Canada, or at least in my area, we don't get referred to pediatricians automatically. Like when you're in the States and have a baby, normally your child has a pediatrician automatically. That's not the way we do things here. We have a family doctor that follows the kids, and if we have more serious issues, then we'll get the pediatrician involved. So we went yesterday and got some really terrible news. So she explained to me that heart murmurs are super common in one area of the heart because, now hopefully I explain this to you guys right. When the baby is in the womb, they already have a natural hole in their heart because that is how they get oxygen from the mother. That will close after the baby is born or right before, somewhere in there. Sometimes it takes a little bit longer for those holes to close. They normally don't cause any problems. They're called innocent murmurs. It's not something that you really need to worry about. However, Weston's been having feeding issues. We've pretty much had to give up breastfeeding because he will struggle so hard to get the milk. And he suck because I have to use a nipple shield, so he has to work twice as hard. And he'll exhaust himself trying to eat and then won't eat and will just fall asleep. So we've been trying bottles and he still won't eat. When he does, he will not eat any more than 2 ounces at a time, and he'll be 11 weeks old on Monday. It's affecting him to the point where he's losing weight. He was 11 pounds, 8 ounces on the 27th of August, and yesterday on the 9th of September, he weighed in at 11 pounds, 6 ounces. So he's stopped gaining weight and started losing weight. He, like I said, won't eat any more than 2 ounces at a time, and that's like when we're lucky. The most that he will eat without an issue is about a half an ounce. And like I strip him naked, I move his hands all around, do whatever I can to wake him up, and he just won't. He's tired. He's tired from trying to eat. And we have like a faster flow nipple, slower flow nipple, doesn't matter. He just won't. It doesn't matter. So his murmur is affecting his growth. Sorry, my hand's starting to shake. So, which leads the doctor to believe that this is not a hole at the top of his heart. This is a hole at the bottom of his heart, which is a little bit more serious. And because he has started to lose weight, there is a chance that he's going to need surgery. I'm going to try not to cry because I lost it yesterday trying to explain it. So in order to find out what's going on with his heart and where the hole is and how big it is, he is going to need an echocardiogram. And that is going to happen next Wednesday at the hospital, and he is going to have to be sedated for that. So before that, he's going to need an ECG, and they always have to do an ECG before the echo, I'm told. That's happening on Friday, this Friday, and the echo's happening on Wednesday. Normally, in my area in Canada, it takes forever do not pull his hair, young lady. Do not. Eliana. It takes forever for a referral to go through, and it takes forever for appointments to be booked in, and she said this is serious enough that she wants to see him again on Wednesday, regardless if we can get in for the echo or not. They already called me and said that that's happening. He's also going to be seeing a dietitian, and he's going to be put on a fortified formula, I guess, because I don't have enough calories in my breast milk right now. I don't know, and I don't have enough calories, or the calories in the formula that he's on when I supplement are not enough. I think she said there's 20 calories per ounce, something like that, and he's gonna need something that goes 30 calories an ounce. I'm told this stuff is ridiculously expensive, like ridiculous expensive, so I worry about that. She said more than likely he's gonna need a patch to fix the issues that he has on the patch on his heart, and that will be done out of province at a sick kids hospital. There's two options depending on the size of the hole in his heart, that he's either going to need open heart surgery, which is the more likely one, just a second, or they might be able to go up through his groin, and the same way they would put a stent in a heart patient. Be gentle. You love Weston? He loves you, baby. Yeah. Aw, that's cute. She's giving him kisses. Anyway, so this is what I'm dealing with now. I'm dealing with a bunch of other stuff too, but I'm not gonna get into that. That's just what is going on with Weston. I'll probably be taking quite a leave of absence from YouTube for a while. I already have taken a leave of absence from my YouTube Facebook, so if anybody's wondering why I'm not posting on there, this is one of the reasons why. I'm not sure when I'll be back on YouTube, but I need to concentrate on my kids and see. Yeah, you're playing with toys. Oh. Need to concentrate on the kids and get this situation figured out. Hey, 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 gentle, gentle. 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 That's not gentle, okay? That's good. That's a good job. So, when we know you're not a baby anymore. She's starting to act like a baby again. Eliana! When we know more, I will come back on and let you guys know. Can you believe I still have this bruise from when I fell down the stairs when I was 11 weeks pregnant? Has not gone away. Crazy. Anyways, I'm going to wrap this up because I got a whiny little kid, huh? Are you whiny? Yeah, anyways, and I will talk to you guys at a later date. Bye.